Hello everyone, Maria Baker here. I'll be going over the opioid epidemic. The opioid epidemic is one of the most devastating public health and economic crises in the United States. Addiction rates and overdose deaths continue to rise, mainly due to synthetic opioids like fentanyl. This epidemic not only destroys families, but also costs the nation billions of dollars each year. Laws such as the Halt Fentanyl Act aim to stop the flow of illegal drugs, while research shows that treatment programs, especially for those in jail, can save lives and reduce repeat offenses. Addressing the opioid crisis requires both policy enforcement and evidence-based rehabilitation to save lives and rebuild communities. The growing problem. According to PR Newswire, published on September 30th, 2025, Fair Health's opioid tracker found that opioid use disorder diagnosis among commercially insured Americans increased by 39.8% between 2021 and 2024, rising from 386 to 539 patients per 100,000. This shows the problem is getting worse and not better. When addiction rates rise this fast, it tells us that people are still struggling in silence, and our healthcare system isn't keeping up. It's a wake-up call that we need stronger prevention and earlier intervention. According to PR Newswire Association, LLC, published on October 15th, 2019, the Society of Actuaries reported that the opioid epidemic cost the U.S. economy at least $631 billion between 2015 and 2018. These numbers prove the crisis affects everyone, not just those struggling with addiction. The cost isn't just emotional, it's financial, hitting taxpayers, employers, and entire communities. Causes. A White House report published by Athena Information Solutions, PVT Ltd, on March 27, 2025, estimated that illicit opioids, primarily fentanyl, cost the United States $2.7 trillion in 2023 alone. This evidence shows how the source of the problem has shifted. Fentanyl is so powerful and easy to smuggle that it has changed the entire drug landscape. We can't fight this crisis unless we focus on stopping illegal distribution while also helping those already addicted find a safer path forward. According to Continent Eugene, published on July 17th, 2025, the Halt Fentanyl Act created a minimum 10-year prison sentence for trafficking more than 100 grams of fentanyl or its analog. This law shows that the government is taking stronger action to hold traffickers accountable. But even with harsher penalties, punishment alone won't solve the crisis. Real progress comes from pairing strict enforcement with better treatment options and public education. According to the National Institute of Health, published on September 10th, 2025, a study found that providing medications for opioid use disorder, MOUD, to incarcerated individuals led to a 52% lower risk of overdose death, 56% lower mortality, and 12% fewer reincarcerations. This research proves that treatment works, even in jails, where people are often forgotten. When we treat addiction as a health issue, not just a crime, we give people a real second chance. Wow. The opioid epidemic continues to devastate families, strain our healthcare systems, and damage our economy. But the solution isn't one dimensional. We must combine enforcement through laws like the Halt Fentanyl Act, which compassion and rehabilitation programs proven to save lives. The evidence is clear that addressing both legal and medical sides of this issue offers the best chance to reduce overdose deaths and help our communities recover. Thank you so much.